1 minute. Thank you everyone for joining. We're just going to give it another minute or two before we begin. Thank you again. We'll give it about another 30 seconds. While we're waiting for everyone to join, I just want to let you all know that Mike Willett from the Intertribal Council will be moderating. And we ask that if you have any questions, that you put them in the chat and we will address them all when we finish our discussion. Also, I would like to ask of you to please take some time tomorrow to fill out our post-event survey, which allows us to develop training in the future and identify any areas where we would like to improve in our discussions with you all. With that, we'll begin introductions. As you all know, remedying health disparities in Indian country requires effective communications to engage our culturally diverse populations. And we want to let you know today and always that you don't have to be a graphic designer to create motivational health education and event flyers. You just have to create messaging that resonates with your audience. However, today we are very blessed to have Sarah Keller with us. She is a health education specialist with the Intertribal Council of Michigan. We also have Kate McCarthy with us, who is a graphic and visual design specialist. And then along with the Intertribal Council, my name is Beth Seeloff, and I will help moderating and host this event today. Sarah, would you like to introduce yourself?
Yes, thank you. As Beth said, I'm Sarah Keller. I work for the Intertribal Council as a health education and communication specialist. I do a lot of cancer control and prevention work, as well as social media managing and creating public health materials.
Thank you. And Kate, thanks for joining us today.
Absolutely, it's my pleasure. Thank you for being here, everyone. I'll just tell you a little bit about Studio M. We're a creative studio that helps organizations tell their story in a compelling way. Our purpose is to craft design experiences that inform, inspire action, and advance social equity. We work in all visual media to build powerful brand messages across all channels, and that means from digital and print to the built environment. I'm really delighted to be here today to support ITC and help provide tips on how to make more impactful communication tools.
Thanks, Kate. Thank you, Sarah. And I'm Beth Seeloff, and I'm a health education specialist with the Intertribal Council of Michigan. Specifically, I work in cancer prevention and control, and I am very delighted to hand this off to Sarah, who is going to introduce us to health literacy.
Thank you. Yeah, as I said before, I do a lot of social media, so I have a good passion and interest in making health communications materials and education understandable to the public. I have a huge passion for health equity, and I do believe that one of the ways we can work towards health equity is to get better access to health information and making it understandable, which really is the definition of organizational health literacy, the degree to which we're making our work understandable. And actually, this slide is a great example. On the left, we have this paragraph, a bunch of text that you all can probably read and understand. But then on the right, we have it broken down into more of an infographic, talking about what is health literacy. So it's readability, plain language, and then making sure that someone can go make informed decisions and their ability to understand health information. And I want to take a deeper look and as we frame this webinar on health communications around health literacy. And we're going to play a TED Talk that we found, which really describes the importance of health literacy and how it's going to allow us to connect to our audience and engage our audience. So Beth, would you like to play the video?
Yep, we're gonna find that patience here, right? Where we. And here we go.
This is my dad. He's actually one of the smartest people I know. As you can see, he's a Cardinals fan. That's because we're from St. Louis, Missouri, which is where I grew up. I was there a few months ago. We were having breakfast. We're having a conversation. Dad, how's your health? I'm doing great. Next week, I'm going to see my gynecologist. Your urologist. Oh, yeah. Dad is not alone, though. He got a little mixed up. Raise your hand if you've ever been confused by a medical term or something your doctor said. In my 20 years of experience in public health and medical epidemiology and medicine, this confusion transcends race, gender, age, income, and geography. That means we have a problem with health literacy. Health literacy is the ability to understand and utilize health information. But what's interesting is we're bombarded by health information almost 24 hours a day. But people are still confused. They don't know what to eat, how much to drink, who to see for what. We have low health literacy, and low health literacy can get expensive. Latest cost estimates of health literacy, low health literacy, are up to $238 billion a year. That's because people who have low health literacy are more likely to enter our healthcare system when they're sicker. So they show up in the ER, they're hospitalized, they may even have surgery. These are our most expensive forms of healthcare. Now, I've been thinking about this for a long time. I've been trying to figure out, how do I use my interest and my skills to teach people about basic health information? So one day I was in a bike shop and I met a videographer named Francis Tatum, and I told him about my desire to educate people. So together we created Dr. Lisa on the Street. Take a look. Doctors often speak in a language that people don't understand. Has this ever happened to you?
Pretty much all the time.
Oh.
This has to be.
But mechanic said.
I'm not cooking food properly. That's some of them. Well, that's no.
Okay.
Don't want one. I see everyone pushing it. They keep pushing it. They're gonna keep pushing it. I'm sick of corporate America pushing stuff on me.
Sean got some Pop-Tarts.
Yeah.
Okay, didn't you just tell me that we have to cut down our sugar?
I did.
And you're diabetic, and you have Pop-Tarts and Fruit Loops.
These are like kidneys or lungs.
You said kidneys are lungs?
Kidney or the lung.
So that's the kidney, this is the lung.
The hospital with her one day, and she wanted to say she was pregnant, but she said, "Oh, I got a stomach ache," and something like that. So it depends
You go to the emergency room, get a physical? So do you have a,
Sometimes, it
yeah.
all depends.
But how do you think we can get the message out to them?
The way you're talking to me now, each
Right.
one teach one and
Oh.
spread the news.
All right. I'm Dr. Lisa. I'll see you on the street. So what have I learned from walking the streets? I learned a couple of important things. The first one is the grapevine is a powerful educator. Now, I suspect most of us are getting some of our information from the grapevine, whether it's through casual conversation or the media. It's like the game of telephone. You tell the first person, and then by the time it gets to the end of the line, the message is all garbled. But the grapevine's not all bad. It's actually pretty effective at transmitting information. The problem is a lot of the information just is not true. And when bad information gets on the grapevine, it creates chaos. A fantastic example of this is the recent Ebola scare. Remember that? There wasn't enough information reaching the public. So the grapevine took over, and what happened? We closed schools. We quarantined people in hospitals. We barred people from airplanes. We even kept the cruise ship from docking. That's because there wasn't enough good information on the grapevine to counteract all the misinformation. This is a great example of why we need better information on the grapevine. Now, the second thing I learned, and I knew this to an extent already because everybody I talked to on the street had a doctor. But I learned we are failing to educate you, our patients. And I think we're failing for a couple reasons. First, because our tools are outdated. Not just our physical tools, but the strategies we use to communicate with people. For example, this is a health literacy test. I ask a person to read the words on this paper, then I give them a score, and voila, I'm supposed to know if they're health literate. Now, this test might tell me if someone can read, but I'm pretty sure it doesn't tell me the things I really care about, like will she take her medications or will he keep his appointments? And look at this. I still have a fax machine in my office. Raise your hand if you've never used one of these, right? At a time when patients are asking us to communicate with them via text and email, doctors are still communicating via fax, and even my dad has a cell phone. But we're also failing because we use language that's comfortable for us and not you. I asked one of my colleagues why he wasn't testing his patients for HIV. And he said, well, I've had most of these patients for 20 years. It's just awkward to bring it up. So I thought for a minute, and I said, do you prescribe Viagra? He got the message. He was denying his patients an opportunity to be as healthy as they could be. So why does all this matter? It matters because research shows that for every $1 spent on health literacy, we can save $25. That means if we spend $1 million on health literacy, we can save our system $25 million. That's impact. But it also matters because of people like John. He says things like, I don't trust doctors. They're nothing but drug dealers working for drug companies. But then he said something that really struck me. He said, doctors don't listen. If I go in for a headache, I don't want you talking to me about my liver. I just want something for my headache. I had to explain to him the headache is actually a symptom of a much bigger problem, and it's our job to figure out what's causing the headache. Well, John was diagnosed with diabetes 2 years ago, but before that, he hadn't seen a provider in 10 years. And at that time, the doctor told him he was pre-diabetic. But He didn't go back because he felt fine, but also because he didn't like the way the doctor spoke to him. Fast forward, he sees another doctor who says, guess what? You have diabetes. He puts him on medication, but John stops taking the medication without even talking to his doctor. And almost a year later, he's rushed to the emergency room in an ambulance in a diabetic coma, and he spends 8 days in the hospital. He is a great example of why health literacy matters, and our healthcare system is flooded with patients like John. So what can we do about it? First, we can manage the grapevine. The grapevine is like ivy. You know what happens to ivy, you've seen it. If you don't maintain it and control it, it spreads like wildfire. And bad information travels very fast on the grapevine because it's associated with drama. And people usually love drama. But we don't want to destroy the grapevine, we actually need it. We need it to help counteract the misinformation. So what can you do? Before spreading information on the grapevine, verify it. And don't believe things just because they sound true. Next, I think doctors need to embrace technology, but you have to push for it because the change in our healthcare system comes from demand from you. And nowadays, almost everybody has a device. I was riding my bike last week and I turned down this small road and there was a group of people standing on the street and nobody waved, nobody even saw me because they were all looking down at their cell phone. I believe if we are this captivated by devices, we should definitely use them to educate people with health information, don't you? So you push your healthcare providers toward technology. Thank you, please. Take control of your health. Your health literacy is up to you. So avoid gaps in care. Remember John? It took him 10 years to get back to the doctor. But his illness was completely preventable. Find your healthcare provider. John was frustrated because he and his doctors were mismatched and they didn't meet his expectations. Unfortunately, there's no match.com for doctors and patients, but that's a hint to you entrepreneurs out there. He became frustrated and discouraged and he gave up, but he was the one who suffered in the end. So don't be like John. And finally, be persistent in getting the information you need. Ask if you don't understand something unapologetically. I know office visits are short, but that's our problem, it's not yours. So speak up and get the information you need to be healthy. I'm Dr. Lisa, and I'll see you on the street.
Great, thank you, Beth. I love that video. I think I'm again so inspired by her talk about health literacy and meeting people where they are. And I think she did a great job at giving examples of what people want from their healthcare system. And so how does health literacy apply to health communications? As the video showed, the man was saying, just tell us what you want us to do and we'll do it. And I want to go over a couple tips on how we can take the lessons from health literacy and put them into our health communications work. So the first thing is knowing your audience. What are their health barriers? What kind of demographic or education levels? What is the appropriate platform of health communications? Maybe it's social media. Maybe you have an older audience who would like a flyer in the mail. Do we need to put an address on the flyer for an event, or can we just use a QR code? So really looking at the needs of the audience and what their culture and needs are. And the second part is, what do you want to happen? What is the call to action? And this is really the main takeaway of your poster or flyer. This is really the action piece. So for example, if the audience need is to prevent cancer, then what do we need to happen is saying, get screened for cancer, go get a mammogram. That should be the front and center. If the audience need is to lower cholesterol, the need, or what do we want to happen, is using diet and exercise. And again, for preventing communicable diseases, the message should be wash your hands. And there's so many examples, especially right now for COVID, the message and what we want to happen is getting them to show up to get vaccinated. And these are also called calls to action. And so we're gonna go over more calls to action. And first I'm gonna hand it over to Kate so she can go over how we improve some of our health communication materials, and show you how we noticed some errors in our messaging. So Kate, will you please share with us?
Sure, thank you, Sarah. So what you're looking at is the two posters, and the one that's labeled number 1 is sort of the before, and then number 2 is the after solution. So if you look at number 1, you can see that it says call today. Well, what am I calling about? You know, the what is really missing. And actually, before I even go into that part of it, I wanted to talk about a few design principles, because, you know, we all think, you know, why is design important? Well, how you design something really influences the way that viewers interact and are impacted with your message. So when you're implementing a design purposefully, your communication tools can be used to create not only an emotional impact on the audience, it also enhances their overall user experience, and you know, imparts the critical information that you're trying to get across. So as Sarah said, you really want to start with your audience needs. You know, what is the purpose of the communication tool, which is what that first poster is missing. And then how do you connect and engage with your audience? And then what is the end goal? So there's a certain hierarchy in the structure of design, and I'll talk about that in a minute. But going back to these two comparisons, so the first one again has a call to action, you know, right up in the beginning of the top part of the poster. Don't know why we're supposed to call. And then it gives some statistics which are interesting, but there's a block there of connecting with that and figuring out why that's important until you get to the text that's in the red block next to it. That kind of fleshes out, you know, what this is about. So, and then it does have the logos of the presenting organizations or participating organizations. So the second one, label number 2, you can see this is, you can see the reason for this program right away at the top: get help to quit smoking. So if I'm trying to quit smoking, that's going to catch my eye. Or if I know somebody who wants to quit smoking, I'm going to look at this. And then the second part is really fleshing out the reason why you might want to think about stop smoking. And then it just has one very simple statistic to sort of build some credibility and good information in there. Then we have the call to action. So now you know it's, you know, what this is about, why you should call this number. Here's the number. And then there are also the participating organizations. And I always suggest, you know, including a phone number or a URL whenever you can. So yeah, going back to the structure, so you want to think about the headline. So you're emphasizing what is the main point of this communication tool. This helps to guide the person through the content and also provides clues as to how to interpret the content. Then you have the explanation, which is the details of the program, and you have the supporting information, the date, the data, when, who, where, a location. You have the call to action. So then you have your link to a website or a phone number. And then you have the organization logos and names. So that's it for that comparison. And then just really honing in on the key points for effective flyers. Of course, less is more. This example is, I think, a pretty effective communication tool because it shows you who's presenting it. It has exactly what it is in minimal text. It's a community health fair. It has a compelling photo used as part of a background element, and it's very engaging. You know, I want to know why these women are laughing and talking. It's pulling me into this story. And then under the big headline, it has, you know, what it is. It's a free health screening and flu vaccination for all. So that means everyone can go. It has the date and the location underneath it with a little bit of explanatory text. The only thing that I would have done differently is maybe move the text away from the people's faces a little bit, because it's kind of right over their mouths. So if you are using a photo as a background, make sure your text is really legible, which it is in this case. And then, you know, Sarah's points are, you know, connect to your audience with relevant photos and graphics. I talked a little bit about how, you know, that can really engage your audience. Be very clear and telling your audience what you want them to do and what the call to action is. And then I love Sarah's point about getting a proofreader who's unfamiliar with the event, because we're all so close to, you know, what we're working on, that we don't really think enough about what it looks like to another person who's not familiar with the event. And then just a few more points. So I always say, you know, be consistent with your materials, whether it's a flyer or a social media post. You want to keep your layouts really clean and simple. You want to think about including negative or breathing space without any design elements. Like for this flyer, there's a lot of what we call negative or white space around the text where the photo is. You don't have to bring your elements all the way out to the end of or the sides of the image. And then you want to use just up to 2 typefaces that are complementary. And I think this one shows a really good example of that. Otherwise, things can get a little busy and hard to read. And then choose appropriate colors and a very limited color palette. So those are my tips. Thanks, Sarah.
Thank you. I just have a couple more too for event flyers. I really like this example because the colors are simple, they're not distracting. As Kate had mentioned, sometimes the graphics really take away from the main message. If we have too many graphics or too many colors, we're not going to see, it's just too distracting for our eyes. And our audience sees like thousands of things every hour of the day. Unless they're sleeping, they're going to be bombarded with messages and people trying to get them to go to things or do things. So organization is really important. We want to use the font to guide our eyes. What I usually do is take the main title, the most important things. So for example, COVID-19 vaccination event, and then a subheading, and then a little bit of body to tell us what's going on. You want to have what's called the bluff, the bottom line up front. You might have heard of this. People use it in emails too, which makes everything a lot easier. Your audience is going to see the main point right away, and it's what their eyes are going to see first is the most important. And then we have our details, which are a little bit smaller. In this poster, they have what you need at the event, what you need to do. They have the location really big, and they did a really nice job of using different font styles, so like bolding it or making it capitalized, and then just the sizes to make things stand out really nice. And then again, they have their logos on there, but they're not taking up the whole poster. And then definitely making sure we have a very clear who, what, when, where, and how. So what is it that they're doing? Who is it for? In addition to who's hosting is really important. And when is the event, of course, and where? And then thinking about if we're going to use an address or just the location or maybe a QR code, depending on the audience, and then how they can sign up. So for this example, they have a nice phone number at the top to register. And then the last thing is, I just want to stress again to get a proofreader who is unfamiliar with the event. Just because your eyes are going to be tired, we need to zoom out and see how the entire poster looks. And this is obviously not a perfect example. There's a lot on it that's going all the way to the corners of the page, but I do think the message is pretty clear, but definitely proofreaders, make sure there's no typos. And you're coming at it from a viewpoint of, you know what the event is, or you know what the message is, and your audience has no idea. So it's important to get someone who doesn't know what your event is to look at it. And actually, I'm gonna have Beth go through some examples of posters that maybe could have been proofread a little bit more.
Thanks, Sarah. Thank you, Kate. I'm going to talk about bearing the message. And when we talk about the bottom line up front, we do that so we don't bury the message, right? We want to make sure that our reader, our patients, our clients know the who, what, where, when, and how it applies to them, right? So these two flyers, we have one which was a COVID-19 clinic, and I just invite you to internally organize within yourself some things that could be different. And so this who, while they used this category of who for who was sponsoring it, right? And so the most important thing is who the event is for, and that got buried, right? It didn't even end up on the poster. And so while we want to show our sponsors, they are not the priority. Our priority is getting care to our clients, right? And getting vaccines in arms or getting cancer screening kits in people's hands. And so we had that issue there. We had an absence of an address, and this is a local event. And as someone pointed out just a few moments ago, they put the globe, right? So we could have used that space for an address or maybe a little county map if they wanted to show that area, or maybe some clarifying instructions on who is eligible, right? And so there was just a lot going on with this that could have been improved. And then this absence of confidence, right? Leave a message with your name and phone number and someone will call you back, right? So there's really no accountability, and we want people to have confidence, like who's going to call them back, right? Because we all use our smart devices, right? And they're not answering calls unless they know who it is. And so they'll either delete the call, maybe delete the message without even looking. And so we want to make sure everything is as clear as possible. And I invite Kate and Sarah, if you want to provide any additional comment on the COVID-19 vaccine poster before we move on to the other.
You know, I really liked the organization, but I think just some of the details, as you had mentioned, were really unclear, which made this event hard to understand.
And I want to actually say that the event got canceled because no one signed up. So this is what can happen. And we don't want that to happen. We want to get vaccines in arms. And so we'll go on to this state of Tennessee, which is really hard to read. If you get close, you can kind of see that it's the state of Tennessee Medical Reserve Corps volunteer program is seeking trained medical. But that is all buried, right? It's that thing that Kate referred to, is that the font is not legible because it's buried in the photos. And so we know that they need us, right? And we know that the city of Memphis needs us, the Medical Reserve Corps needs us, and public health needs us. And there's a QR code, but the message is buried. So there's just lots of room for improvement. And we're not putting these up to pick on anyone in particular. We're just showing areas where we can make changes, and just these tiny little changes can improve the outcomes of any event that you're hosting. Next slide. So this is a great poster, right? This is what's happening, right? Vaccine clinic, right? What is happening, who is eligible, right? 12 and up eligible to register. Where is the event? The only improvement I would make in this area is maybe putting the address of the Norris Center, because as you know, many people were traveling, far distances to get a vaccine, and they may not have been familiar with the LSSU Norris Center. And then call to action, register here, visit this link, right? And then here, leave a message with your name and phone number for a return call to schedule your vaccine. So it's a complete message. It gives them confidence that someone's going to call them back to schedule the vaccine. So they're repeating, get the vaccine. We're going to schedule the vaccine, register for the vaccine. And the only other thing I might add, right, is you could use bit.ly or tinyURL and shorten that URL to something memorable, right? So that they could just memorize. It could be LSSU vaccine, right? And then, quickly people can put it into their device, or when they get home on their computer, and register there, or even the addition of a QR code. But this is a very effective poster. I'm sure they had some good responses here, and the clarifying notes are there, they're present, they're legible, and a font that people can read. So I think this is a great example of something that anyone can do at their desktop. And I just want to reemphasize, we're not all experts, right? And so that being the case, Sarah is going to introduce us to Canva. And Canva is a free program that people can use to design and collaborate on their posters and flyers. So Sarah, do you want to take us on a little tour of Canva?
Yes. So this is Canva. I can post a link in the chat later, but just canva.com is this resource I use almost every day for social media graphics, or I've done different reports, as you can see my designs here. And event flyers is really helpful. You can go and make a free account. We found that the free version is pretty accessible. They do have a pro version if you're a nonprofit that you can get for free. So we are actually in the process of trying to get that too. But even if you can't access the pro version, they have tons of free resources as well. So the nice thing about Canva is that it's pretty user friendly, and they have tons of templates based on whatever which kind of graphics you want to design. So you can either search by a keyword or the type of poster or template. So I'm going to type in some words here, and we can see what we come up with. I'm going to do health fair, and you can see it comes up with a ton of examples. And I like to go through and see what is fitting for my event. You really have to choose based on your audience and your needs, and then your layout that works for you. And then you can go in and you can edit anything in here. So even if I wanted to move this or change one of these, the undo button is really helpful. Editing the text. And you can see here, I really like this because they have the main title. They have a little bit of text, the event location and dates. And actually, we can go and make this bigger if we want.
Sarah, I have a question on the graphics. So if I remove that, do they have options to replace it?
Yeah, so actually, let's say I didn't want this Band-Aid here. I really love this Elements tab, and we can say, I want something else. And maybe you wanted to put a mask on there. And then this actually, you can change the colors up here, and it will give you the colors of the theme. And so it's a really nice switch out. Some of these templates have second pages, so depending on what you wanted, maybe you wanted to move this text to this page, and it's fun to play with. If you wanted to move this up and add your logos, you can upload any photos you wanted just right into Canva, and they stay in your account really nicely. Let's try another example. Let's do vaccine. Again, they have, Canva is really updated, so they'll have a lot of templates to use.
And Sarah, these flyers are also appropriate for social media?
Yes. So you can kind of play around with what size you want, but they are really easy once you're done to download them into a picture or a PDF. And I find it's really easy and simple to download it into my computer. And actually, one of the features that I love about Canva is that, let's say that Beth and I want to work on this poster together, or we start one from scratch together. I can go ahead and add her. I'll type in her email, it didn't come up, and then it basically works the same as a Google document, where this is all saving automatically, as you can see over here. All the changes are saving as you're working, and we can work on it together without having to email back and forth, which is super nice when you're going to proofread, so that you can just send it right to your coworkers or whoever and say, take a quick look, and they can comment right here and say, I think you need to change this. And actually with this one, maybe you want to not have, some of our communities, we found they don't love having the needle, so we can go ahead and replace. Canva has a ton of free photos to use. And you just type in, like, I think I had typed in community, and you can find one that maybe represents what you want a little bit better. It's pretty easy to play around, and you can crop things as you see fit so it fits better. And of course, you can upload a lot of these. Not all of these are free, but you're welcome to upload photos that you own, or find free photos elsewhere. But it's really good for fact sheets. Let's just do maybe one more on a public service announcement. Or So this one would be great for Instagram posts. This is a World Cancer Day public service announcement, but let's say it's not World Cancer Day, but we still like this. We can go ahead and just remove that or add our own. And add your logo to this. This actually isn't a free image, but again, we could probably find a different one for free, which I absolutely love. I guess this one has a lot of colors on it, but and again too, there's plenty of options for text, and it will kind of keep the same fonts here. If you wanted to add more text to this, it's pretty simple. And so that is Canva. There's also this great Learn tab, and I don't have any formal training in Canva, but I've pretty much taught it to myself with just using it all the time. But we can open up this webinar to questions now. If you guys have questions on Canva or any other of the topics that we've covered today, I'll go ahead.
Well, it looks like there's a couple of questions that have come in. One person here asks, does Canva allow for taking a creative flyer and easily make social media content from it to save having to start a flyer from scratch? So if they already have a flyer, can they make something else out of it?
Yeah, that's a great question. I've done this quite a couple of times with different posters that we've done, and they don't fit great into Instagram or something. Let's say, let's try this. The resize feature you need to upgrade for, but it's pretty easy to crop things from either a screen grab, or usually it lets you resize.
Can you show us one of ours that you've done, Sarah?
Yeah, if I could jump in, I believe that you can only reformat it to a different size, like if you're going from a poster to an Instagram post with the Pro version. But it's really easy to copy and paste your elements into a new size. So you can easily do that. So that's a way around it. And then I think someone had an answer.
Yeah.
Jaylyn responded that you can save or download your files as in all these different formats. So it's very flexible.
Mm-hmm.
And I think someone, Liana, hope I'm pronouncing your name correctly, mentioned Rebrandly. So I'd just like to say that Canva is one tool, and it's one that Sarah and I have been using, and we've been quite happy with it. But yes, there are other platforms out there and other web apps that you can use for doing this kind of work. I would like to add and really try to emphasize that if you're using any of these platforms, it's a great idea to really hone in on a couple of fonts that you want everyone to use, because again, designers are all about consistency across all of your materials. So, if you can pick a color palette and just a few fonts, and then, ask everyone to use only those, it takes the guesswork out of, what to use, because there are so many choices. And it will make your materials look so much more professional.
Mm-hmm.
Thank you, Kate.
Yeah, it saves you time too. You don't have to go searching for what kind of font am I going to use this time.
Exactly.
Mike, are there any other questions?
Yep, this person here says, are these templates and overall suggestions ADA friendly? I.e. font selection, color contrast and use, avoid busy backgrounds, plain language, and alt tag images.
Yes, Canva is ADA compliant. And I think you bring up a really good point with the ADA compliance, because we do see a lot of posters with many colors, right? Like sometimes 10 or more colors. And as you know, people with visual impairment can't pick up the contrast of these colors. So thank you for bringing that up. Canva is conscious of that. And as you go through their examples and their samples of posters and flyers, you will see that.
Mhm.
This
Mike?
Yep, this person here says, where do you recommend posting flyers and such to get more people to sign up for classes? Only social media, or do you have any ideas or other avenues?
So I'll start and then I'll let Sarah kind of pick up. With flyers, you want to look at the demographic of the population you're trying to reach. So if you're trying to reach elders, right? Maybe it's better to put flyers in their mailbox, mail them postcards. Those places, it depends on the subject. Restrooms are great places to put flyers for some events. Human resource areas where people go in and these touch points for folks, right? You don't, and you want to take your flyers down after the event. So that's another thing, is putting the flyers up is one thing, and then taking the flyer down in the net is the next. And then I'll let Sarah talk a little bit about the use of social media, because as we have our elder population, and then we get into our younger generations, and the transition is moving from the paper flyer to social media. And it's really important that we recognize social media, because many of your clients 40 years and older are using social media, and our elders are using social media. So Sarah, would you like to comment on that?
Yeah, I've been putting pretty much everything on our social media pages. We use Instagram and Facebook, and kind of, as someone had commented, you kind of have to change the sizing a little bit, but we also have used Hootsuite a little bit so that it can help with cropping and posting things. And what we've done actually, even for this event, is creating Facebook events on our social media page. And that way it kind of notifies your audience better. And I really love collaborating with other organizations, other public health or tribal organizations nationally, so we can share resources. And we've been working, our clinics have their own social media pages, so we'll tag them so they can share it on their page. And it's been pretty, I think, useful for us.
The outreach of social media is incredible, right? And the nice thing about building, so if you have a flyer and you build an event in social media, even though the event isn't taking place on Facebook, if someone is interested or they sign up, they're going to get a reminder. So, right, so it's that extra support, because all of us, I'm sure we're all guilty of signing up for something and then forgetting the event is happening. So that's another aspect of social media. So we encourage it, and if
Your
you'd
audience
like
is definitely on it.
to
So,
let us know.
gotta meet people where they are, as we've been saying for the last hour.
Right.
So speaking of social media, this next person says, although it wasn't discussed too much in depth today, would you might be able to speak a bit on hashtags?
Sarah?
Yeah, whenever I put out social media graphics or public service announcements, we have a list of hashtags we use. And I've looked on Instagram actually to see what hashtags have the most posts, because the algorithms on social media, they're going to kind of categorize, let's say someone really is interested in like breast cancer awareness or different health topics or Native American Indigenous health. Maybe if we added a hashtag, Instagram's going to show that to that person.
And so the hashtags, if you, and we can do another talk on this, if y'all are interested, please put that in your evaluation and we could do a whole hour on hashtags because it is a skill set that we should all build on. And I think we could go on for quite a while here today on that. So, but you are welcome to reach out to Sarah or I on the hashtags. And if Kate, if you have any expertise on that, you know, we will certainly engage Kate on that.
Thank you.
This next person says, any tips on creating engaging internal flyers advertising virtual course offerings for employees?
Well, I'll go first. I think that if you use the same principles that we've been talking about, and just emphasize that it is a virtual event, then I think you would probably be able to create some effective tools for engaging people to attend it.
Yeah, and if it's an internal flyer too, you could download it as a PDF. So the Zoom link or whatever is clickable on the email.
Right.
Does anyone else have any questions?
There's nothing else in the chat box or the question box.
Oh, you know what? I just noticed one. Jasmine asked, are we able to add our own video files to Canva? I haven't tried doing that, but Sarah, do you have any?
Yeah,
information on that?
I think you're definitely able to upload. We haven't done that before, but I've seen this. So even audio, Canva has a lot of features to make things more engaging now. They have a lot of like animation, but yeah, I would assume I'm not sure exactly what the file type would need to be, but it's really, in my experience, been easy to upload images. So I think that would be the same. And then you would just download it here as a video. Hopefully that.
So you would upload the video and then download the video, right?
Yeah.
Basically.
Yeah.
Great, thank you. Well, I'd like to thank everyone. This can be watched again on Facebook. Chi miigwech to all of you for showing up and for doing everything that you do for your communities today and always. And we will have the PowerPoint slides available for you. And we will make a recording available for you. And all we ask for in return is that you fill out the evaluation, and please let us know if there are any other subjects that you would like to be expanded upon that came up during this conversation or something that wasn't. And if we can't help you, we will find the experts who can. And that being said, Kate, I want to thank you so much for showing up here today for our community and for everyone across the United States. Thank you.
Thank you.